some of the myths that I have encountered people say. One is people think that fertility is only and always dependent on age factor. So it is presumed that if you are young, fertility is going to be fine. And this is a myth. It may not always happen that just being young kind of makes it is certain that the fertility will be fine. The second thing is people think that as long as health is good, fertility will be maintained. But we have seen that many times, in fact, especially in men, sometimes who are into a lot of sports or are taking some kind of steroids for bodybuilding, there could actually be a problem in the sperm factors. So it is not necessarily true that just because the health is perfect, the reproductive health or the fertility potential is also good. The third myth usually that people come to me with is when they say that I'm 29 years old now and I have been married since the last 4 to 5 years. And we've been open to a pregnancy since the last 4 to 5 years, but there has been no pregnancy. And I was told that you're young, you have enough time, so you don't need to do anything, just keep trying. Now, I would definitely like to tell everybody that, in fact, the younger you are, the faster should be the fertility. So, if a young couple is facing issues with fertility, then it is better not to wait for such prolonged periods, but in fact, to try and understand why the fertility is getting delayed. So, the younger you're expecting that the pregnancy should happen within a year, if not at least a year and a half. So if a young couple is taking 4 years, then there definitely should be a problem. And it does not mean that they can just go ahead and just wait because they've still not crossed the age of 30. The next myth that I see many people having is they think that IVF is a kind of a treatment which will give people pregnancy at any point in time. Recently, one of my patients who is in the US, when we were having an online consultation, she mentioned to me that, doctor, you're telling me that my IVF pregnancy rates may not be very high. And why is it? Because IVF is meant to be here for women who are older. So please understand, IVF still uses your own gametes, right? Your own eggs, own sperms. So the effect of aging or the effect of any other pathology will come on the gametes that are used. And therefore, irrespective of whether you go in for IVF, the older you are or the lesser the number of eggs that you have, the pregnancy rates will change depending on that. So IVF is not a panacea for everybody, and it does not mean that let me just delay my pregnancy, because eventually, if I don't get pregnant naturally, I can always take a recourse to IVF. It does not work that way. So that's a big myth.